Lymphatics, what do you know? What have you heard? In this video, we're going to give you practical steps that you can apply today to help your lymphatic system. Welcome, well-beings, to the first installment of the treatment room. And many of you are clients of mine, and a lot of times I'm asked, who treats you when you're in when you're in pain? What type of practitioners do you see? Here's one of them. This is a colleague of mine, definitely a mentor, a mental athlete, I would say. We work together. We've gone to school together. He is a chiropractor, registered massage therapist, registered acupuncturist, also did the McMaster's.
Yeah, the
Medical acupuncture practitioner, and currently just got a new designation. There's much more designations I want him to expound on, but there's a current designation which we're going to unpack a little bit later on, which is the Vater's course.
Yeah,
you did the Vater's lymphatic drainage Vater's course, level 1 and 3. So we're going to expound on that a little bit. And this podcast is for individuals that are interested in lymphatic drainage, don't quite know a lot about it, but there's a lot of pain points, a lot of questions that we will cover, that we've researched that are pain points for a lot of people. But first, Alan, if you could we were talking about your journey as a practitioner, because I want to give context to here, because I think that you have a very unique perspective as a chiropractor. And I want you to just kind of go through your journey a little bit. Where did you start on this journey of being a healer or a healthcare practitioner? And then we'll take it to where your current designation, if you will, with the Vater's course. But if you could just give the audience a context of your journey as a healthcare professional. We were talking about it a little bit more, but yes.
So I'll rewind a little bit and just frame it in regards to once I came to Canada. I've been in Canada for 30 years now, coming from Trinidad and Tobago. Once I came here, I was not able to go right into university. I always wanted to. There's some type of education bias that we have, I would say, and university was always looked upon highly. So I sort of accepted that and always wanted to go. Not putting down college. I think college is excellent. And I think for those who want to do what they have to do, they really have to make up their minds. But no one was going to tell me that I was going to go to college at that time. Okay.
Yeah.
So I did not know what I wanted to do, but I was always good in sciences. And I loved biology and chemistry. So I ended up pursuing an undergrad, started off as biochemistry, but ended up graduating with a Bachelor of Science. So at that point in time, I was not too sure as to what I wanted to be or what I wanted to go. So we're talking about the book Mastery.
Yes.
By Robert Greene. And that book has a lot of the tidbits of information that I recognized that I had applied these principles in terms of making up my choice. And I could say that with those designations that you said before, I'm extremely happy to be practicing and doing the things that I do. In fact, all it does is make me recognize how much I don't know. The human body is so remarkable that every time I scratch the surface and feel like I've arrived at something, I feel like I can't grasp it anymore and I need more information to try to bring me down. So after getting, at least finishing that degree program, I was trying to pick at straws, and I was giving you the story in regards to me having this type of experience where what I consider was an experience where Qigong was experienced, where you can at least have an influence on somebody with your energy, a conscious sort of perception. So going forward, I started looking into that and the energetics. And once I had to come up with a sort of an idea as to where I wanted to go, I kind of concentrated it down to the alternative medicine practices. acupuncture, RMT, chiropractic, physio, those kinds of things. And while doing my research, once I came across the chiropractic philosophy, which is that the body has the innate ability to heal itself. But further to that, what the course curriculum outlined, it spoke volumes for me, and that was my major decision as to becoming a chiropractor. I could say at that time I'd never been treated by a chiropractor. I was sold on the philosophy and the course curriculum. So,
I mean, most of the chiropractors that I've worked with over the years, being in healthcare, 20 years, I find it's very interesting as a chiro that you didn't just go to medical-based acupuncture, but you also became a registered acupuncturist of Eastern medicine, traditional Chinese medicine. How were you able to, I'm not saying reconcile, but there are many chiros that frown upon that and consider it quackery.
Yeah.
Right? Like even, and I have a family member as a physiotherapist, and I did, when they found out I was doing traditional Chinese medicine, they're like, why are you doing that? That's quackery.
Yeah.
So can you just speak to that?
Well, everybody's going to have an opinion, right? There's some people that have opinions about chiropractors and call them quacks as well, too.
This is true.
So I can't really change what people's opinions are. I have to go with my own opinion when I do research.
Exactly, as you, from your vantage point. Forget other, but I'm saying as a chiro, for me, I haven't met chiros that I see so many chiros, so many physios that do the medical-based acupuncture course at McMaster's.
Yes.
However, I have yet to meet a chiro that has done that and also done traditional Chinese medicine. What led you to consider that path as well?
Well, again, coming back to my interests and my experience again with what I had considered qigong, I never felt satisfied. I am rarely satisfied with what I know. So I am always pursuing knowledge. So that's a huge part of it. The medical acupuncture program at McMaster was fantastic.
Yeah.
From an anatomical sense, learning
with Alejandro.
Yes. Fantastic.
Yes.
Having said that, as much as I felt equipped, I still felt like something was lacking. In fact, I didn't want to practice some of the points because I just felt like the course was too fast and I did not grasp all of the safety mechanisms. So to be honest, I was a bit hesitant to be doing points on people that I wasn't feeling 100% about. That's me.
Yes.
That might not be somebody else. Yes. That's just me. Okay. Yes, I'm not saying that the course failed to deliver that. That's just how I came out of it.
Yes.
I used to do points on the shoulder a lot if I took anything away from that course. And when I did that, I felt like, you know what, I'm getting some good results with it. And I still didn't feel I knew much about acupuncture in the traditional sense. I knew about the medical acupuncture with the nervous system and that sort of thing. That's how we were dealt, right?
Yeah.
In fact, just not pain modulation, but modulating the nervous system in a sense. So whether it's through helping somebody with pain or bringing down their sympathetic and raising the parasympathetic, whatever you want to call it, I felt like I needed to know more.
Yeah.
And I wanted to expound that upon the entire body, not just on the shoulder.
Yeah.
To see what I can help people with.
Yeah.
However, what really led me to doing that was I was called you one day.
Yeah.
And when I talked to you, I was asking you what you were up to, and you said I was just coming from my Tai Chi class.
Yeah.
And I was like,
Jesse.
I said,
Big up to
Tai
Jesse.
Chi, yeah, where you learning Tai Chi? And you said, oh, I'm doing this acupuncture program, it's TCM. And I said, you learn Tai Chi? You said, yeah, and Qigong too. And you said Qigong.
Yeah, you were locked in.
Everything just came full circle for me. And it wasn't, at that time in my life too, I was at a crossroads. I was thinking I wasn't happy with the way that I was practicing and I wanted something fresh. And you put that into the mix, it was a perfect storm for me to decide, let me look a little bit into this. And it doesn't take me long to make a decision when it comes to education and taking a course.
What was the value that you saw? Like you did the because some people feel I got the acupuncture, the medical-based acupuncture, and I'm just going to continue to double down with that. What was the value that you saw in traditional Chinese medicine acupuncture?
Well, again, it was another avenue for me to explore, which is great for me. I'm learning, so it's keeping my brain intact in a sense. But mainly that TCM is not just a protocol that you follow, it's a lifestyle.
Yeah,
so
that's
even if I didn't use a single needle, or at least given any of the value that I got from it to the public or the patients that I treat, for me, myself, as a way of life, looking at, because it's a philosophy that you're using and you're applying that, right? So that philosophy, I think, is paramount for me with how I live, how I make decisions, in a sense, looking and not taking things on in terms of stress, understanding the yin and yang. So, those concepts have formed a different pathway for me to look at life. So
beautiful.
It's not just that as me practicing it onto people, it's me
Practicing
on myself. Yeah.
We got to unpack that. There's a lot there. We got to unpack that. But now what's interesting, after that, you became a registered massage therapist, which is that's very interesting as a chiro. All the chiros that I've worked with and all the clinics that I've worked with, what led you, now you're a chiro, you did medical-based acupuncture, then you did traditional Chinese medicine, acupuncture, and then you became a registered massage therapist. What led you to embark on that process?
There's a few things. Again, we're going to come back right back to my thirst for knowledge.
Yes.
And there's never just one reason. There's always going to be a series of events that happen. So when we were in that acupuncture program together, right? You were the one that told me about the Qigong. I looked into it. Again, I looked at the curriculum and I said, I'm going to do this. But it's funny, you always get this cross-pollination of different types of practitioners, right? So within our class, we had about 10 people, 8 of whom I think were registered. Yeah, I think it was 10 of us.
Okay.
10 of us, right?
Okay.
As I remember. And 8 of whom were registered massage therapists, right?
And then 2 were?
Michelle and I were not.
Okay.
Michelle was psychologist, and I was the chiropractor at the time.
And we had a doctor in the class too. That was the other class.
Those were the merged classes.
Those are merged classes. Okay, yeah, but yes, continue. Yeah.
So Reza from Iran.
Iran, yeah.
So what led me to that was when any of you guys, as much as we were doing acupuncture, when you guys put your hands on me, it felt different. Anytime a massage therapist put their hands on me, there was a different type of, I don't want to use the word energy, but there was a different feel that I felt. And I appreciated that. So there was that. And I think I had voiced that to Ivy. And Ivy had mentioned, hey, you know that there's this program at this school to become an RMT. And I said, at that time, I was like, nah, how much things am I going to do type of thing, right? Like, there's formal school, and then there's, you just reading stuff and gaining knowledge, right?
You're lifelong learning.
Yeah. Yes. So this is beyond me saying, okay, you know what, I don't want to jump into something else right now. But then COVID came. Yeah. And as we were finishing our TCM program, I think our last few classes we had to do online. Yeah. There's like a month or so left that we did online because of COVID. Yeah. And then COVID came and everything shut down. Yeah. So I started thinking, okay, well, everything is shut down, and I don't know when we're going to go back to work. I don't know where this is going. So there was a very small overlap between us finishing and that RMT program starting, which was a condensed program from the school that they do it within a year's time, and you have to be like a health professional, or at least have some health background. So I looked into it, and they said, by XYZ you'll be done. And I said, you know what, I could do this. This is seamless. Yeah. So that's what really made me. So I could say my thirst for knowledge, yes, it's usually the driving factor, but I think there's always other things that you have to put into the equation as to what made that my decision. So again, the thirst for knowledge, also trying to be able to deliver something else to a patient. I recognize that soft tissue and massage and their techniques are very calming in a way, and I would always do that as a chiropractor to try and warm up before if I had to do an adjustment. And in some cases I would just do soft tissue treatment.
Yes.
So I started saying to myself too, maybe there is more to this that I need to look at.
So now you're the massage doc.
Massage doc. Yeah.
And if we could just tell the audience, where do you practice?
I practice in Whitney. I practice in two other clinics, but Whitney is my main location, and that's where I want to grow my entire practice with all the other ideas that I have brewing in my head.
And do you have contact?
Well, I have a website. You can always go on massagedoc.ca. And you can schedule something. You can see all my education and my stuff there. And that's always, because I'm always learning something, it's always in the process of being reformulated and reformatting just to reflect my current statuses.
And now we have another tool in the toolbox. So this is what we want to start to unpack now. How did you lymphatic drainage, the Vater's course, what's led you there? And then we want to ask you a few questions with respect to, we're going to open up this lymphatic conversation. Yeah.
It's funny, because when I was well, first of all, I never really got much knowledge from any of the programs or courses that I did about the lymphatics. Maybe touched on a little bit here and there, but I always felt like the lymphatics was like snuffleupagus in a way. Like you hear about it, but when you come around, you never see it, type of thing.
Yeah.
So it, lymphatic drainage is a real catch term now.
Yes.
You hear about it all the time. It's really trending, right? And I think that has a part to play with me looking more into it myself too, because when your ear is to the ground and you want to see what things are going in the health perspective, lymphatics is up and front center right now. So when I was at the massage college, it was talked about, and we practiced a few sequences, but I remember practicing on someone and I fell asleep actually practicing with them, and I said to myself, I'm never gonna do this. I'll never
too slow.
Yeah, it's
too soft.
Slow, man. Yeah. It's putting me to sleep, and that person fell asleep as well too. So last year, I think we always talk about medicine and practice and things that we could do to help people, and the lymphatics came up, and the Vater name is like the international name. Dr. M.L. Vater was the one who sort of stamped it, and the lymphatics was known before, but he kind of formulated this protocol of being able to do lymphatic drainage. So looking into that, and regardless of who I see and for what reason, the person in front of me is a person. And with my tools, not everybody's going to be adjusted. Not everybody's going to have massage. Not everybody's going to have acupuncture.
And sometimes when we have one tool, if you have a hammer, everything is a nail, and you have to understand that bias, right?
Absolutely.
And what one client may respond to, another may not, right?
100%.
So we say in traditional Chinese medicine, one disease can treat 100 treatments. Right. Excuse me, one disease can have 100 treatments, and one treatment can treat 100 diseases. But continue. Yeah.
So. On that note, it was similar. I started looking at the lymphatics or lymphatic drainage or lymphatic treatment as, okay, where can if I'm going to look at this, how does it fit into my current practice? Am I being redundant?
Yeah.
Or is it something like each of the things that I have done can be put together? So there is a synergy that they complement one another, whereas, the whole is greater than the sum of the parts type of thing.
Yeah.
But at the same time too, when I learned something, I want it to be something that is different. I don't want to confirm my bias in a sense and just repeat something that I've already done.
Yeah.
So, with acupuncture, which is totally different than massage, which is totally different than chiropractic, it's still done on the same person to try and have a positive effect on whatever their condition. So experience comes into play as well to see. So it's always trial and error. I tell some of my patients, you're an experiment to me because I don't know how this is going to go for you, but let's see.
Yeah.
So when it comes to the lymphatics, my, again, thirst for knowledge, but lack thereof, because most of the other things sort of take away the TCM acupuncture, which is a totally different way of learning and seeing the body, you could see how massage and chiropractic and even the medical acupuncture can have a lot of overlap, right?
Yeah.
But the lymphatics, though it is part of physiology, is totally different to what I was learning as well. So you have to be a healthcare practitioner, and a lot of massage therapists are the one who do it because it's a manual therapy as well. But as looking at becoming a lymphatic therapist, it was really about how I can affect someone. And, a lot of it has to do with inflammation in the body. And when you think about the treatments, why people get lymphatic drainage nowadays, besides as an aesthetic, a type of treatment, it's for
The
it's
immune
used
system.
for oncology treatment,
Yeah.
where you see swelling and where you see a lot of swelling. So you'll hear the term edema, whether it's lymphedema, whether it is phlegmedema, whether it's lipedema. And a lot of these terms, though I know it, if you asked me before, I couldn't really talk about it. I didn't have
So
much knowledge of
can
it.
you expound that for the novice out there, for people who are not familiar,
Mhm.
how would you differentiate those terms now?
So the lipedema would be more, and these things are characteristics, and sometimes you have signs and symptoms, but really it comes down to the person's experience. So lipedema is more of a condition where there could be a lot of genetic predisposition to it, but it happens mainly in females, if not 100%. And there is fat deposits that are circulated more or less, or deposited more or less on their buttocks areas, their glutes, their upper thighs, and it can go all the way down to their legs. So there is a certain characteristic that you look at physically, and these people would have like tightness and pain, and they'd have a lot of easy bruising and stuff like that in their thighs, and like I said, their lower limbs.
Mhm.
Whereas lymphedema, there are different types, and I'm not going to bore you with the different ways of going into it because it can get deep. But
Yeah.
lymphedema nowadays, if you're supposed to look at it from a North American perspective, is the most common presentation would be a person who has had, let's say, breast cancer,
Yeah.
and they've had lymph node dissection, they've had radiation, they've had a mastectomy, and that type of interventions will damage the lymphatic system,
Mhm.
which is 70% of it is right underneath your skin
Yeah.
throughout the entire body. So damage to that would mean that the fluid, or the way the body takes away fluid and puts it back into our circulation, is damaged as well. So the person will end up having swelling. Before they see the swelling, they might feel heaviness,
Mhm.
they'll feel sluggishness, and people probably won't see. One of the easy signs when you do see the swelling is to press into the skin, and you'll see something we call pitted edema, right?
Yeah.
So that's lymphedema. Phlegmedema is another condition that's happening a lot based on our sedentary lifestyle, people not moving a lot. So it happens mainly in the legs, if not nearly 100% of the time. And it's a venous condition. So, the umbrella term would be chronic venous insufficiency. These people would present with varicose veins. As it progresses, you'll see that swelling, and it can turn into an edema, and lymphedema can also happen because of it as well. So those are like the three big types that we look at. And it's not just those that it happens to, like in pregnancy, when women's legs swell up, that has to do again with the venous insufficiency probably happening. And some of these women, due to hormonal imbalances and stuff like that happening at that time, can end up having a lymphedema develop over time. So yeah, that's those would be the three major categories that we would have, that we would see nowadays in terms of presentation, and the treatments that we would be giving the lymphatic treatments for.
There's been just a resurgence with lymphatic drainage lately. What do you think is driving this trend? You touched
I
on it
think
a little.
knowledge. I
Mhm.
think knowledge, because to be honest with you, as a healthcare practitioner going through these different types of education, like I said, I was not exposed to it enough, which is why I did this course,
Mhm.
and I still am learning. There's more to this
Mhm.
than meets the eye, so I'm not gonna just say that I'm an expert. I'm definitely not, but I know a lot more than I did before, and I feel a little more comfortable treating people with some of these conditions. And, I've seen people with these conditions, but in the past, but I was never able to recognize it. It just looked like swelling. Every swelling is an edema, but you can't really categorize it the way that I just did earlier. So when it comes to this resurgence, as you say, I don't think it's a resurgence. It's more of knowledge being disseminated, especially through the hierarchy, because the surgeons are now becoming more aware of it.
Yes,
You know,
yes.
family doctors are
Manual
now.
lymphatic drainage, yes.
Yes. So these terms are still not well known,
Hmm.
even to the surgeons, where a lot of this is happening now. It's happening because of surgery.
Hmm.
So and it's any surgery can disrupt the lymphatic system. There is inflammation that happens when somebody is injured, and you can consider surgery an injury when they cut through the skin. So you'll get the swelling and the redness, and the person has to go through this timeline of healing. And in most cases, with a normal person that has no other comorbidities, they should heal.
Yeah.
The scar will form, and the person should be okay. They might have, a thicker scar, a thinner scar, but they should be okay. But with all the different diseases of lifestyle, especially in this first world country, North America as well, when you look at the statistics, cardiovascular disease and cancer are 1 and 2, and they kind of flip flop, right?
Yeah.
For women in Canada, cancer is the number 1.
Yeah.
As much as breast cancer, the survival rate has increased. I think it's about 75% now. They still have to go through those procedures such as mastectomies, and like I said, the radiation and the chemotherapies, and all of these can leave them, their immune system drained, but the way that their body heals already, a little bit enamored. So when we go forward, that resurgence is really when people are looking for care. The more survivors we have, the more swelling that they have.
Yeah.
The more they're voicing their concerns and saying, why am I having this? And then they go back to the doctors, and the doctors are like, okay, we don't know. So now I'm hearing that even some clinics, some surgeons have lymphatic therapists that are working alongside them now.
Yeah.
So it is, I don't want to say getting better, because I haven't really done that comparison, but the knowledge is being put out there more.
Yeah.
Number one, because we have more survivors, but we also have an increase in the prevalence and incidence of the cancer. And it's not just cancer. It's being overweight.
Yeah.
People who are sedentary, they're more prone to.
We're dealing with a sedentary lifestyle crisis. So
right.
Yes.
All of these things will aid towards people having conditions where lymphatic drainage and manual lymphatic therapy and the decongestive therapies are necessary.
And it's so important for people to know it's not just about having a snatched stomach and snatched legs. It's framed very cosmetic in a lot of people. But let me ask you this question: what are some of the misconceptions you find that people may have with their first treatment with lymphatic drainage? Are you seeing some common misconceptions where that's concerned?
Not necessarily. I mean, if I have to talk about misconceptions, I would talk about what I have heard from other people, so indirectly, which is, again, because people don't know, they don't understand that, some of the basic tenets of a manual lymphatic drainage, as Dr. Vaughter had outlined, and in his protocols, are that it's very slow, it's very rhythmic, it's monotonous. Those are terms that they use, right? And it put me to sleep. It could put people to sleep, but that's because it's having an effect on your sympathetic nervous system. So it has this effect we call sympathicolysis, which helps to bring down your sympathetic nervous system, which is your fight or flight. So once somebody has manual lymphatic drainage, they become very relaxed to the point that they can fall asleep. So if I was supposed to look at that in terms of a misconception, it's really that essence where people look at it, they hear massage
and they think it's tough and it's heavy, but you're not massaging muscle, you're massaging the lymphatic system.
Exactly.
Yeah, and then we see Brazilian lymphatic drainage, no slight at the practice, but we're seeing a lot of very vigorous movements where it's concerned. And could you speak to that? Like, how does that address the vigorous movements in lymphatic drainage versus what you learned in the Vaughter's course, to qualify that? Because I think that's a misconception I see, is sometimes you're doing what is anatomically effective and reasonable to address the lymphatic system based off of where it is in the anatomy. And people have this misconception like they're being robbed.
Well, at the end of it, at the end of the day, when somebody has a treatment, I think what's the number one thing? That the patient is safe. The second thing is that there should be some type of goal, right? And because we're manual therapists, we are affecting the person to achieve that goal. So I don't know anything about the Brazilian lymphatic other than what I have seen. I haven't experienced it myself. So I don't want to rob anybody of the effects if they are a therapist that they may be getting. And if it's positive, great. Where I think it's not really a misconception, where things can get um, sort of mismatched and put together is when people use the word lymphatic drainage. And there are different systems. So I have studied the Dr. Varda system. There is Closer, there is Foldy, there is Casely Smith. I think that's the way that I'm saying. There's a couple others, and it depends on which region of the world that you're in. So I don't even know much about those. I will look into studying those too. However, I think when we talk about the lymphatic system, if it's under the skin, really, it's not a glide, it's not a slide, it's a stretch, and it's done really slowly, and it comes back. You kind of set the body back to zero when you do that to be able to have that manual effect on the lymphatic. If you press too hard, it has the reverse effect, which can cause the smooth muscles to tighten up, and you don't want that. You need a free flow.
Yeah.
You need the people to relax, whoever you're dealing with, so that the smooth muscle in the lymphatics can do its job and not spasm.
And I think also you drive according to the weather conditions, depending on where people are in with their health versus, if somebody's had surgery versus somebody who has lymphedema versus somebody that's relatively healthy. So there is a different approach, and there is, also depends on what the treatment goal is.
So going back to that, the Brazilian stuff, what I have heard is that the practitioners who do that, and it's mainly in this body contouring and people who've had
Yes, it's more cosmetic because I've done it
like that,
and yeah,
right?
Yeah,
I heard that it works.
Yeah,
right. So where some people have an issue is the fact that the word lymphatic is attached to it, and I think they're two totally different systems. And for me, it really doesn't matter at this point.
Okay, so let's get into post-operative cosmetic surgery. After a facelift or a neck lift, when is it typically safe to begin lymphatic drainage, and how often should someone come in for the first few weeks?
So those questions really depend on the person. Each person will react different to surgery, even if it's the same surgeon doing the exact same procedure. Again, we'll go back to, does this person have any other underlying diseases that may decrease their ability to heal? Because it's healing that you're trying to help, right? When you're doing lymphatic drainage, what you're trying to do is create an environment in the body, especially locally where that swelling exists. You're trying to push that out where you are taking some of the metabolic waste, and which is, macrophages coming in to eat up some of the debris because of the surgery, because of inflammation, because of dead red blood cells, all of these things. You're trying to have an effect to clear the area. So in TCM, we talk about stagnation.
Yeah.
Right? So stagnation is like the mother of all diseases.
Yes.
When you stop moving, things start to decay,
Yeah.
right? We always use an analogy of water in a glass. You can have 2 glasses of water, you leave one out there. It's just there. After a few days or so, it started to become murky. If you have the same exact glass of water at the same time, just with something spinning in it, it stays nice and clear, right?
Like a bayou versus a river.
Exactly.
As long as it's healthy, as long as it's moving, right?
Exactly. So there are bacteria and stuff that's present everywhere, and if you give it a breeding ground, it's going to be opportunistic and it's going to take advantage of that. So it's the same thing with our human body. So when it comes to not just cosmetic surgery, any type of surgery, firstly, you have to speak with the surgeon to make sure that this patient, it's safe for them to start. Usually, you can start lymphatic drainage ASAP, right? Reason being, I won't use cosmetic surgery. I'll take a knee surgery, for example.
Yeah.
one of the principles of lymphatic drainage is that we start proximally. So you have a knee that is swollen because of surgery. That same day, you don't have to work on that knee. You can work on the thigh. You know, when we start lymphatics, we open up the terminus.
Yeah.
So you start doing things here because this is really the drain. This is where everything returns into the circulation, into the venous system that goes into the heart. So you start opening up the drain, and just doing that alone will have a suction effect anywhere in the body where there's that congestion. So it'll start pulling away from there. But you start there and then you go to where the local lymph nodes are that are proximal to that area of congestion. So for the knee, if you're using the knee, the inguinals, the lymph nodes in the inguinals will be that area.
The pubic area.
Right.
Yeah.
So you would go right
the groin,
the groin, the hip there, and you would open up that. You'll sort of bring that to life in a sense, so that suction will start to pull up. And you don't even have to go to the knee. You don't have to touch the knee. But by just doing that, you're going to start that clearance, because the lymphatics move centrally. So you're pulling up from the knee and starting to get rid of that inflammatory response, which we need, but we need to control it so that it doesn't cause too much swelling, which will cause pain, which will also reduce the likelihood of healing. So, you know, the lymphatic drainage techniques and that system has shown to be very helpful in cosmetic surgery as a treatment. There's strong evidence to support that, as well as in certain types of surgeries. Not all, some have weak evidence, but if you use these principles, I think in most cases, you'll be able to help somebody and affect their recovery process in a positive way.
Okay. Thank you for that. Now, what's the difference in approach when you're treating post-op swelling on the face versus the body, like a tummy tuck or lipo?
So let me not talk too much into that, because that's something that I have to explore even more. So I'm not going to go too much into something that I haven't sort of put my head into the sand and really absorb the information about.
Beautiful.
However, with both types of surgeries, you know, a tummy tuck, I've heard people dying from certain types of cosmetic surgeries, like BBLs and stuff like that. You know, I just talking to you here, I would gather that, you know, it would have to really do with the type of surgery, because there are different types. So in regards to, again, lymphatics, I don't know if you're trying to talk about the Brazilian again when it comes to that, but just from my approach, a Vado approach, it's a very simplified approach. There are contraindications for it.
We're going to get into that.
Yeah, we can leave that later. But as of right now, I wouldn't see much difference into my approach in terms of treating somebody, anyone who's had any type of surgery, if I'm using the right principles at the right time.
Indeed. So now let's get into lymphedema and chronic swelling. For someone managing chronic swelling after cancer surgery, what can they realistically expect from regular lymphatic drainage in terms of day-to-day quality of life?
That's a great question. Again, I mean, these are specific to diseases. You know, we touched on a certain procedure just now, which was the cosmetics. Now we're talking about oncology. Anyone that has a chronic swelling, and if this person, let's say this person had cancer, and I would go back to my previous example with somebody who had cancer, and breast cancer, and they had a lymphedema in the arm. You know, these women, they talk about feeling heaviness, feeling uncomfortable, and it can lead to pain and tightness, distension, all those sorts of things. I've never experienced that, so I can't give you my, you know, a first take on that, but what I can do is talk indirectly and say the quality of life will definitely be better. Now, it's not just a lymphatic treatment. You could be a level 1 or level 2 lymphedema therapist, but you don't know how to treat lymphedema, or you haven't been taught how to treat lymphedema. So the lymphedema is, we will apply other techniques to it. So when it comes to lymphedema, we have 4 tenets, 4 pillars that we really try to employ. Number 1 would be minor lymphatic drainage to help get some of that swelling out. Number 2 would be some type of compression therapy. So the compression therapy, people have heard about compression garments, whether it be compression socks. You'd see compression sleeves as well. You see some basketball players using some of these things. Right? So The compression garment would be number 2, which will help to contain that limb once you've gotten some of that swelling out, and you don't want that swelling to come back. Because if you don't do anything about it, it's just going to keep refilling.
Yeah.
So you pump it out with the manual lymphatic drainage, then you use a sleeve, let's say on the arm, a compression sleeve, or depending on how big and if there's more swelling to be pushed out, but you just couldn't get it within that time frame, then you would bandage the area, right? Until the person is able to fit into a sleeve. Once we get it down to a size where we don't really see much swelling decreasing with the manual therapy. So that's 2, the compression. And we can talk about pneumatic pumps after that. If
so, you know, that's going to get into that. How do you integrate compression garments and at-home self-care into full lymphedema management plan, along with manual therapy?
So the manual therapy is one limb. And we're talking limbs. So the second limb would be, like I said, either the bandaging, compression therapy, and sometimes we can use these interchangeably, but you need to be using one at least at a particular time. The pneumatic pumps would be something that somebody could use, which will help with that too. And the research has shown that has been really, really good to work synergistically with the other 2 as well. Skin care is another tenet or another pillar of the decongestive therapy, we call it, which is people who have these lymphodemas because of the congestion and the stagnation within those. You don't have the immune system functioning as well, because now you have more tissue and more fluid to work through. So the white blood cells can't get to the areas that they need to do the work that they need to do. So that kind of causes this negative cycle and causes more swelling as well to happen. On top of that, that causes pain as well. So the pneumatic pump can be very helpful for people to be doing on a daily basis. And once they finish doing that, they can use the compression sleeve that they usually use. And so skincare, keeping the skin clean, so that you don't, cellulitis is a disease that infects, and it can become septic getting into the bloodstream. So that's one that people who have lymphedema can get. They are more prone to getting it. I think it's something like 70-something% are more likely to get it. And if you had it already, then it becomes even higher. So skincare would be the 3rd part of the tenet. And then the 4th pillar would be exercise. So, you know, as therapists, you know, we're manual therapists, but manual therapy is only one part of treatment. What the person eats, how the person moves, you know, their stress level, their support network, you know, even spirituality, all have a part to play in their health and them, you know, getting healthier and healing as well, right? So those would be the 4 parts of it. And then with the pneumatic pump, like I said, it's something that you can add as an adjunct. From the research that I showed, anybody who has lymphedema, they should have one of these things. All right. It really helps. It doesn't take the place of lymphatic drainage, but when you think about it, you know, we live in Toronto, the GTA, you know, winter time is here. Some people, they don't want to go out, especially when you have a lymphedema, you're uncomfortable, you're in pain. You don't want to have to go to get therapy, even though you know that it's helpful for you. If you have a pump, you can be using this on a daily basis, sometimes several times a day. Again, it doesn't take the place of a therapist, because a therapist not only put their hands on you, but they give you comforting words. They kind of look at you and can see your progress as well, to track the progress, could see if anything else is going on that you need to either go to whichever practitioner for referrals. So, you know, there's a time and place for everything, but a pump can do a really good service for people in terms of helping to treat that lymphedema.
Thank you for that. So still have quite a few questions here. So I appreciate the depth of, rapid fire.
Go.
Okay. So digestive issues and bloating. Many clients ask if lymphatic drainage can help with bloating or IBS. What does evidence actually say about its role in digestive health?
Well, I mean, if you think about digestive health, you know, the brain and the gut the brain gut axis, they work in tandem, right? So, you know, then you have to start asking, okay, why is there this digestive issue? Is it something that the person ate? Is it something that's hereditary? Are they dealing with a Crohn's disease, some type of inflammatory bowel disease? So really getting to the core of what's going on is the most important. However, if there's inflammation, if there's discomfort, when you think about lymphatics, it's moving things. It's getting things that are stuck, unstuck from a fluid level. So some of the side effects, I wouldn't even say side effects because side effects have this negative connotation. One of the effects of the lymphatics is people would feel like they need to urinate a little bit more after, right?
Yes.
So it can really take, because it's actually taking fluid, like between 2 to 4 liters of fluid is what the lymphatics puts back into our regular circulation, right? So when you're helping that, what you're doing is you're taking whether excess fluid and inflammatory products are part of the byproducts of metabolism. And, you know, if you have a digestive issue, you have an issue with metabolism as well. So the lymphatics system is trying to do its best to try and contain things and bring things back. And lymphatic drainage is just a conduit to help assist the body in doing that. So as a therapist, I tell people too, just as a disclaimer, I can't heal anybody. You know, the word healer makes me feel good. You know, it strokes my ego. But at the end of the day, I can't heal anybody.
That's right.
I can only help
the body with the natural healing process.
Heal yourself.
Indeed.
Right?
Indeed. Yeah. Disabuse yourself for that, right? If a busy professional wants lymphatic drainage for gut health, what kind of frequency and lifestyle changes would you recommend to see real results?
So again, okay, a busy professional, when I hear a busy professional, we're not talking about weight. We're not talking about what their exercise routine are. We're not even talking about eating. When I hear busy professional, I think stress right away.
Yes.
Okay.
Yes.
So
stress leads to tension.
Right.
Tension leads to retention. Retention leads to contention in the body.
Yeah.
You don't pay attention. So you can say,
do that again. Let me put a beat to that, man. So, going back to this question here, if I hear a busy professional, I just hear somebody who's just on the go. They're stressed out. So from that point of view, again, the sympathikolytic effect of manual lymphatic drainage, it can really help, balance their nervous system in a way where, again, people fall asleep getting this type of treatment, right? It's very light, very soft. It's only a little bit of pressure is used. I think it's something like 20 to 30 milligrams of mercury in terms of the force that it's used. Don't quote me on that. So it's very light. So from that perspective, a busy professional who's stressed, again, gut-brain axis, the stress can cause digestive issues as well. If people
That's right.
it can cause liver qi stagnation, which causes everybody to stress up. This is where breathing comes in, and we didn't even talk about that in terms of the lymphatic system. That's one of the effects.
And the thoracic duct.
Thoracic duct, sternochyli, which is right above the L2, around the L2 level. Taking deep breath, deep diaphragmatic breathing can help to assist with that pumping action. So the body has this built-in system. We're just tapping in with what we know from a physiological level and what effects that we have seen through research that Dr. Vada has done. It's not just Dr. Vada. Dr. Foley was part of it. The Wittlinger group in Germany or Austria, I think it is, still a big part of it as well too. These guys have a clinic, I think it's in Austria, that the government pays for, that you can get treatment on a daily basis for a month. On a daily basis. And they see things like burns. I've seen pictures where burn victims have had 2 treatments a day, sometimes, a few times a week, and the effects are astounding. So if, more, when it comes to this, the more is actually better in this case at the beginning. But for like any patient that you would see, once you start seeing a positive effect, so let's say somebody was coming and you can have lymphatic drainage every single day. You definitely can. Depending on the condition, you can have it more than once a day. So if a busy professional had the ability to come several times a week, then do so. As they start seeing the effects and they have lifestyle modifications that you asked for. So having some type of exercise routine that they're doing daily. It doesn't have to be a high stress like a HIIT, but it could be something that's low stress, like swimming, qigong, tai chi, yoga. These type of things can have a very yin type of effect on the body where it calms down the nervous system. These type of people will do well to do that. And again, looking at your diet, refraining from smoking, alcohol, all of these things kind of go hand in hand. So those would be, lifestyle recommendations that I would give.
Perfect. So now, perimenopause and hormonal changes.
Woo!
Yes. Well,
Yeah.
Yes. So how does the lymphatic system play a role in the fluid retention and puffiness that women often experience during perimenopausal
So,
or perimenopause? Pardon me.
I mean, you know, that this is a topic that I am very much interested in,
Yeah.
and that I am starting to look into, which is, the hormonal changes with women and menopause and perimenopause. So any type of hormonal shift can cause, a huge array of changes in the body, whether male or female. Male have the testosterone, but women, when they go through these changes, they have to look at, estrogen, progesterone, and testosterone as well too. So the changes can cause any of those hormonal changes may cause some fluid retention as well. And going back again to inflammation, using the lymphatic system to help drive some of this as a conduit, as a management of these symptoms, can be very helpful. Now, it's not just the lymphatics. It's not, I don't want to tout it as a cure-all, but again,
Can assist the immune system with
100%.
regulating.
100%. Now, they would also have to see an OBGYN that can help them if they so desired with hormonal replacement. They got to look at things like their diet, because, cholesterol goes up, their insulin sensitivity can change when it comes to these hormonal shifts as well. So each woman is different. Some women, they go through menopause without a blip. Most women nowadays are starting to see some changes. Unfortunately, like the lymphatic system, it's one of these things that the doctors
not enough research.
don't know much about.
Yeah.
The research is starting to come out there. So even me, myself, I am ignorant to that, which is why I have to do, because I start seeing patients that are complaining of these things. Now, when it comes to, let's say, something like lipedema, even lymphedema, there are times in a woman's life that they see a lot of these conditions kind of rear its ugly head.
Yeah.
And it's not curable. It's there for life. You can manage it, but it's not curable. Lymphedema. So when they're going through adolescence, pregnancy, and perimenopause, three changes, three hormonal big shifts in a woman's life. So one of my the things that I am very interested now is really learning about that and how I can
likewise
help a woman navigate. Because again, I get people complaining about these symptoms, and that the medical system doesn't really know what to do with it, right?
Yeah. So now this is a big one here now. Cellulite and body contouring. So can lymphatic drainage actually reduce cellulite, or is it more about temporarily reducing fluid around fat cells?
That question, I would plead ignorance. I would. I mean, I've seen body contouring. There's a place for that. I mean, from what I know, body contouring, you're just moving things from one part to the other. Are you really affecting something, whether temporary or permanently? I don't think so. I think things will shift, but it's the same thing with the lymphatic system. If you pump things through and the person has a good effect at this point in time, that's not permanent. I just said that if the lymphatics are destroyed and you have some type of lymphedema, you will always have that. So management becomes the issue.
Mhm.
How do you manage it? And there are resources, there are websites, there are things that people can go on, there are groups where you can get more information. And again, I'm a lover of knowledge and education.
Yes.
People need to educate themselves, and they need to direct their.
I like what you said there, because it's like people see dramatic before and after images online, right?
Yeah.
And what's really happening in those images, and
well, again,
and how should we set realistic expectations?
So everybody has. I mean, they say an image said 1,000 words, but an image can also blind someone to see what they want to see.
Indeed.
So, is it realistic that they see some of those changes? I'm not saying that those images are false. Some of them are right. But how long would it last? That's the other thing people need to ask themselves. You know, what do they have to go through? If you have lymphedema and you're in pain, some people need it broken up because they have fibrosis and it's there for a long period of time.
Yeah.
But again, it has to be under the hands of a skilled therapist, somebody that knows what they're doing, somebody who puts the patients first, their safety first, and not what the effects or the outcome of what a picture says.
Yeah. Indeed. So now varicose veins and circulation.
Mm-hmm.
When someone comes in with varicose veins or heavy legs,
Mm-hmm.
how can lymphatic drainage help? And when do you refer them to a vascular specialist?
So I, as a chiropractor, I can't refer them to a vascular specialist, but I will refer them back to the family doctor with a note. One of my jobs really is to determine what is the cause of that swelling.
Mm-hmm.
Is it because of the varicose veins? Is it because of a lymphedema?
Mm-hmm.
Is it a lipedema? Is it because of a heart condition? Is it kidney failure? Some of these are contraindications for lymphatic drainage. So just because somebody has lower limb swelling, it could be a side effect of medication. Some blood pressure medications, you can get a side effect when somebody has swelling. Really,
Prednisone.
yeah, really the job is to try your best to come to, a diagnosis. As a chiropractor, I can diagnose. As a massage therapist, I can't. But coming up, even as a massage therapist with some type of clinical indication, what do you think is going on? And sending them back to the family doctor who can do the tests, for any type of varicose vein. What you're going to start thinking about in the future is that this person is going to get some type of deep vein thrombosis or some blood clot in their legs, which, can go up to their lungs, know. So you don't want to be doing any type of massage or even lymphatic drainage on those people, because that there is more important than the swelling in their legs to get that treated first. So really is triaging this person to see, as long as they don't have any contraindications first and foremost, and then trying to maneuver into what is the true cause of this swelling in the legs, and then being able to say, are you a person that I can treat, right? Some varicose veins, you don't want to treat the vein. You're not treating the vein, but you can help with treatment of the swelling.
Yeah.
These people, if they don't get treatment, and compression socks are a very good idea for these people to be using on a daily basis to help with circulation and help the venous system push that blood and that excess swelling back up into the circulation. Those people will do well with compression therapy. But really, coming back to your question, these people need to get the diagnosis well. So for these people, a Doppler ultrasound would be a good start, and they would have to go to the family doctor.
So is there any risk in working over these areas with visible varicose veins, and what precautions should you take?
So, as long as you know that, and you wouldn't know, but any type of previous DVT or anything like that, active thrombosis, that's a contraindication. You should not be treating these people at all. If everything is well and good, you've gotten clearance from the doctor. I'd always advise that you get clearance from the doctor. Then you can definitely treat. But like I said, compression therapy for people who have chronic venous insufficiency, varicose veins, is a great idea.
So let's get more into like safety and contraindications. Now, what are the key situations where lymphatic drainage should absolutely be avoided? Such as active infections or blood clot.
So, like we said about the blood clot, the deep vein thrombosis, you're not treating that because there is a chance you can dislodge that and cause more harm than good. It could be fatal if this person has a pulmonary embolism, which is a consequence of a DVT.
What about like active infections? Because you touched on that.
I mean, if the person has a skin infection, you don't want to be treating around that. You can treat before that, but any type of active infection, again, safety is first.
Yeah.
There is a risk that you can spread that.
Yeah.
Either directly or indirectly, and you don't want to have anything to do with that. So besides the active infection, besides the DVT, I touched on it earlier, acute renal failure, kidney disease, that can cause swelling in the legs. We call this decompensated heart failure. Somebody has a congestive heart failure, whether right or left. You don't want to be doing that. Now, somebody can be having a heart failure, but the doctor has cleared them to have treatment. Again, deferring back to the doctor, whether it's a cardiologist, a specialist, or the family doctor to keep them in the loop. Get clearance from them first. There are other contraindications which are a complete no-no, and then there are relative ones as well, which is somebody like that who's had cardiac congestive heart failure, sorry, but the doctors give them clearance. You know, people who have cancers, some cancers, you might be the therapist that sees something on the skin and say, this doesn't look right. You send them back to the doctor. So there is this saying that if somebody has cancer, that you don't treat them. We know that the lymphatic system has been shown to be, at least lymphatic drainage has been shown to be helpful, but you can get clearance from, let's say, the oncologist, somebody who has cancer, and there's no risk of them getting massage therapy or even lymphatic drainage as well, right? So there are clear-cut things that there's a no-no, and there's some there where there's some nuance, and then, but for the most part, if you have no issues, you're good to go.
Okay, so we have 4 more questions now. Devices and compression suits. How do these new LED, infrared, or pneumatic compression suits compare to hands-on manual lymphatic drainage? Do you know about these?
So I touched on that earlier in regards to people. So if I'm speaking, people can use these things for recovery. You know what I mean? I am not sure if the parameters, I would think that different machines by different manufacturers may have different parameters.
Yep.
But you can definitely, as a recovery,
and we're going to Trove to try one out shortly.
All right.
We'll go to Trove and test one out. You'll see. You'll get a chance to see us, get some feedback from us. But continue.
So as a recovery tool, you can definitely use it, because when you exercise and when you exercise hard, you get fluid built up in the interstitial, so within the muscles and stuff like that. So using these recovery tools, and there are pneumatic pumps, they use them for lymphedema as well. Great additions. I recommend them for people definitely who have lymphedema. They can be using it daily, and somebody who's in recovery, they can use it 20 minutes, 30 minutes after they do their sessions. It can really help with just calming them. You relax, but at the same time, it's helping to push that fluid that's within the periphery, not within the circulation, get back into the circulation, and the body clears what it needs to clear and keeps what it needs to keep.
So if a client asks whether they should invest in an expensive lymphatic compression suit or just come in for regular sessions, how would you help them decide?
Well, that comes down to money. If you can afford it, you can do it. But again, going back to the difference between a therapist and, a machine. The machine is going to do what the machine is supposed to do and nothing else. The machine is not going to talk to you. The machine is not going to be able to see other things or hear other things from you, signs, symptoms that you may say, hey, this is doing well, this is not doing well. So therein lies the difference. Mm-hmm. It's convenience. The machine, manual lymphatic drainage can hold its own against any machine.
Yep.
But the machine can definitely be convenient for someone if they can afford it, because these things run thousands and thousands of dollars, right? So if you can afford it, fine. But there's nothing like a therapist, especially when, you have a very good relationship with that therapist. A manual therapist is not just a manual therapist. On the table, people talk about stuff and they get that chi going, because when we're all constrained and we're stressed out, sometimes a good conversation with somebody is enough to put things in perspective. Indeed. And make you feel better. So a machine is not going to do that.
Exactly.
Each person, I'm not here to sell one over the other. I'm just here to say pros and cons versus each.
Okay, so back to this stressed out exec, for a high stress executive, now we're talking about lifestyle and self-care. Mm-hmm. For a high stress executive, what are some quick daily habits they can use to support lymphatic health between sessions?
Oh, well, exercise is good. Light exercise is good.
Exercise?
Yeah, so and this is for anyone.
Anything?
So anyone who is, let's say you're sitting for most of the day. Gravity is not your best friend.
No.
Okay. So your venous system, blood is going away from the heart and sometimes have a hard time coming back up because it's fighting against gravity.
Yeah.
So pumping, just going up on your toes and pumping your calves. Your calves, they say, are your second heart.
That's soleus. Yeah.
Soleus gastrocs, right?
Gastrocs, yeah.
That's it. Well, if your knees are at 90 degrees, it's mainly the soleus that will be active at that point.
Yeah.
But pumping the calves to get those veins, giving those veins help, because the muscle contractions will squeeze the veins that helps to push the fluids up rather than them pooling in there. And that's where that lack of circulation causes a thrombus to form there. So that's a very light exercise. But any exercise, light exercise will be good. Walking around, deep breathing is a great thing that you can do to help your lymphatic system, but also help relax you as well. Because again, going back to the nervous system, it helps to decrease the sympathetics and increase your parasympathetics. So those are very simple things people can do, not sitting as long as they do. Some people sit for hours and hours. If they have a sit to stand desk where they can go in between sitting and standing, if they can get up and move around a bit, that in itself will help the lymphatics, because contraction of muscles and also the arterial pulsation, because these lymphatic systems, especially the deep ones that are in our legs, they travel along with nerves and blood vessels. So anytime the blood pumps through the arteries, it has an effect on the lymphatic system to help push the lymphatic fluid up into the direction of the circulation that it needs to go.
Perfect. Lastly, if someone can only come in for every few weeks, what kind of home care would you recommend for them to maintain their benefits? Yeah.
So again, going back to the four pillars, we do manual lymphatic drainage. There is some type of compression therapy. There is skincare, and there is exercise. So this is mainly for people who have lymphedema, but anyone who has swelling in the legs, these four things, some variation of it would be helpful. So exercise we talked about, and diet is a part of it as well too. If you're prone to eating greasy foods, oily foods,
inflammatory food,
things that cause inflammation in the body, right? Smoking, all of these things will cause this environment of inflammation. You're going to wreak havoc on your system, and the lymphatics being one of them as well. So, I don't need to beat this on a drum, but we shouldn't drink, we shouldn't smoke, you know what I mean? Whole foods, right? Exercise daily, cardiovascular exercise and weight training. Definitely a mix of both, depending on who you are and where you are in this life spectrum that you're on. Will always do well. So looking at your diet, again, looking at how you're exercising, how you're moving, and daily is definitely best. Your sleep, oh my gosh, your sleep. Some of us are fatigued. Some people are working shift work. So there's always this contention and research, should I sleep 6 to 8 hours? Everyone is different, right? There's a few people who can get away with not sleeping that much. Some people can get away with 5 hours sleep. Most of us need continuous sleep, going to sleep when the sun is down and waking up when the sun goes up. That's our connection to nature. You know what I mean? The circadian rhythm. So sleep is paramount in terms of the body being able to heal itself.
These are principles of Tai Chi, or traditional Chinese medicine. Yes, sir.
Absolutely. So I touched on the exercise. I touched on diet, sleep, stress. How do you deal with stress? How does stress deal with you? I mean, there's supplements and stuff people could take, but really, when we talk about lymphatics, and we can talk about acupuncture, we can talk about chiropractic, we can talk about massage therapy. We're talking about health, and everything comes back down to the same thing. If you can look at some of these facets of your life and be able to, have a positive impact, or try to be a little better with all of these, they all add to help each other. And if you're able to do that, you will heal better. Your body wouldn't deal with stress the same way. You can teach your body how to deal with stress by looking at all of these different facets. And there's just about 5 of them, really.
Yeah. Alan, thank you very much. You can see the knowledge is very profound, and his treatment is equally profound. So definitely, if you're in the east end of Toronto, Whitby, and that's massagedoc.com.ca, pardon me, .ca. .ca, no .com, and where you have the address for your.
So it's at 61 Victoria Street West in Whitby. I'm inside the Orange Healthcare Clinic.
Yes, and thank you very much. Appreciate it.
No problem, bro.